Today, we're talking about common court sport injuries. So first off, what is a court sport? Anything you play on a court. Basketball, volleyball, racquetball, tennis, squash. What I really want to focus on are three major joints that we commonly see affected in these sports. Those are your knee, your ankle, and your shoulder. Commonly what you might experience with some of these sports after repetitive motions and just kind of going through all the jumping, cutting, anything you might be doing. With court sports, there's a lot of repetitive overhead motion. So I'll kind of go over a few stretches and a few exercises we need to work on just to make sure those muscles are up to snuff and try to get you guys out of that pain. Back to the knee. We were talking about tightness before, so the first thing we're going to do is try to loosen up your quads. We're going to start with a quick quad stretch, so you're going to stand on one leg and pull the other leg behind you. Just pull back till you feel a stretch along the front of your leg. You'll hold that for 20 seconds, 3 times. We'll do that on both sides. We're also going to focus on your hamstrings. We can't neglect the back of your leg just because we can't see them. So find yourself a low stool, a step, just anything you can prop your foot up on. You're going to put your heel up on that stool, keep that knee straight, and reach forward, keeping your chest up till you feel a stretch in the back of your leg. We're going to hold that for 20 seconds, 3 times on both sides. Quad weakness is a major reason for knee pain. So, to focus on strengthening those quads, we're going to start with a simple exercise. It's called wall sits. You're going to stand right in front of a wall. Then, with your back against the wall, you're going to bring your feet slightly forward and sit your hips down till you're at about parallel. Good. So, you'll hold this position from anywhere from 20 seconds to a minute if you're at that level. What I want you to do is take a break in between each timed period. We'll do that 3 times. We're going to work on your quads, your glutes, and your hamstrings. Really trying to focus on those weaknesses. This is called lunges. So, you're going to stand in a slightly split stance. Then you're going to take one foot about 2 foot lengths forward. You're going to drive that back knee straight down to the ground and come back up. Return to starting position, and we'll do that again. So we'll do this for 2 sets of 10 on both sides. So our next glute exercise is called fire hydrants. You're going to start in quadruped or on your hands and knees. You're going to try to keep your core nice and tight. Then you're going to raise your leg out to the side. Good, perfect. Not so far that you feel your hips start to open up and your back moving. You just want your hips to open up slightly. We'll do this one for 2 sets of 10 on both sides. Finish up strengthening those glutes. We're going to start with you on your back with your knees bent. You're going to focus on squeezing your cheeks together, keeping your feet flat on the floor, and bring your hips straight up to the sky. As you do this, try to focus on keeping your core nice and tight. And focus on squeezing your glutes all the way through the motion. We'll do this for 2 sets of 10. Poor mechanics and weakness are 2 major concerns when we're talking about shoulder pain. So we're going to try to do exercises that focus on both of those. The first one we're going to do is called external rotation. The first thing you're going to do is stand with your elbows at your side, palms facing each other, and pull those shoulder blades down and back with a little bit of resistance on the band. From that position, you're going to keep your elbows together and rotate your hands out to the side. Every time you pull out, you should really focus on squeezing those shoulder blades together in the back and keeping those elbows down at your side. Another great exercise for your posterior shoulder muscles is called rows. So, go ahead and grab 2 fairly light dumbbells, at least till you get used to this exercise. You're going to put a slight bend in your knees, and hinge at the hips, and have the weights down in front of you. From this position, you're going to pull your shoulder blades down and back, and pull your elbows straight back. Nice and controlled, nice and slow. We'll do this for 2 sets of 10. As you pull back, it's really important to focus on keeping those shoulder blades down and back, keeping your shoulders away from your ears. You don't want to hike up. Keep those light dumbbells from the rows. You're going to start laying down on a table, weight bench, court, wherever you can. You're going to put those weights in front of you, and then you're going to raise your arms straight up. From there, you're going to first pull your shoulder blades down and back. Then I want you to do the opposite motion. So you're trying to really pull your shoulder blades apart while bringing your hands forward. The whole time, your elbows should be locked out. We have to loosen up those stiff ankles. Go ahead and walk up to that wall so you're anywhere from 2 to 3 inches away from it. Good. You're going to keep one foot right in front of the wall and just put the other foot behind you. From there, keep the front foot's heel on the ground and bring your knee as close as possible to the wall while keeping your heel on the ground. We're going to stay in that position for 20 seconds and we'll do it 3 times on both sides. Really focus on getting that ankle moving. We're going to do just that. Take your ankle, act like there's a pin between your big toe and your second toe. You're going to write out the alphabet, A through Z, go through the whole motions. We're going to do that 2 times on both feet. To focus on getting you some of that stability back, we have to put you in some of the positions that are going to really focus on making you more stable. So the first one we're going to do is single leg stance. And just like it sounds, you're going to stand on one leg. You're going to try to stay in that position for 20 to 30 seconds, 3 times. So now we're going to get a little bit more dynamic. So again, you're going to stand up nice and tall. You're going to stand on one foot. You're going to raise the other foot off the ground, and your leg off the ground is going to go in 3 different directions. First, you're going to come forward, then back to the middle, out to the side, and then straight back. As you do this, try to keep your core nice and tight, try to stay nice and balanced. If you really have trouble with the balancing, try to find a spot in front of you to really lock your eyes onto. So this last move is going to be the most challenging if your ankles are unstable. I only want you to do this if you do start to feel confident, if you have returned to jumping and things like that in your sport, and if you feel like you've mastered the other 2 exercises. So you're going to stand on one foot, and you're going to imagine there's a small line, like about the width of a crack in a sidewalk. You're going to hop back and forth, side to side, over that line. So you'll do side to side, anywhere from 10 to 15 times. After you do side to side, we're going to focus on jumping over that line, forward and back. Really focusing on dynamic balance, being able to stabilize yourself coming from a jump. If you have any questions, come on down to Loudoun Sports Therapy Center and get an evaluation from our physical therapists here. We can look at your knee, your ankle, your shoulder, honestly any other joint, any joint that's bothering you. We'll take the time to ask you what's been going on, how long it's been happening, kind of look at you going through some of these motions, testing your motion, your weaknesses, seeing and how you move, and we'll kind of go from there. And we'll give you a specific intervention geared towards your weaknesses and helping you get back to what you want to do, whether that's a court sport, swimming, not a sport at all. We'll help you get back to whatever you like to do.